This is an ABC News special report. Now reporting, Chief Anchor George Stephanopoulos.
Good afternoon. We're coming on the air right now with the latest fallout in that breaking news overnight. President Trump and First Lady Melania Trump testing positive for the coronavirus. It was announced at 12:54 a.m. And we have just learned that former Vice President Joseph Biden, of course, was at the debate with the president on Tuesday night, has tested negative. Let's get the latest there from Mary Bruce. Mary.
George, we've just received a statement from Dr. Kevin O'Connor. He is Biden's primary care physician. He says that both the former vice president and his wife, Dr. Jill Biden, underwent additional testing, PCR testing for COVID-19 today, and it was not detected. They are both negative. There, of course, was great concern about Biden's health all morning long, especially given the fact that just on Tuesday night, he spent 90 minutes on a stage with the president at that debate. They were socially distanced, but they were not wearing masks, and we were not aware if they perhaps crossed paths at some point throughout the night that we were not aware of. And of course, you know, given the deep look that is now being given into the president's inner circle, it was notable that at that debate, there were members of the president's family and those close to him who were sitting in the audience without masks. Joe Biden and his team, though, have been incredibly careful and cautious throughout this entire pandemic, and especially as they have started ramping up their campaign events. I can tell you I have been at many of these campaign events. They go to great lengths to make sure that they are following all of the local guidances and precautions. Joe Biden almost always seen wearing a mask. Those who are close to him are tested daily. He gets tested often as well. This morning, they not only are testing Joe Biden and his wife, Dr. Jill Biden, but we also know that many members of his campaign have also been tested as well.
So, Mary, do we know he was slated to go to Grand Rapids, Michigan, I believe, today for a campaign event? Is that still happening?
No word yet on whether or not he's going to be going forward with that campaign event. It was slated to begin in about an hour, so far we don't believe he's traveled yet. So even if it is on, it would appear that it would be delayed. His running mate, Kamala Harris, though, is moving ahead with her planned campaign events today. She tested negative again this morning. We are told she is actually on her way to Las Vegas for a campaign event there this evening.
Okay, of course, this news is rocking Washington and the world right now. Let's go to our chief White House correspondent, John Carl. John Carl, this morning we've also heard from the president's chief of staff, Mark Meadows, a little more detail on the president's condition, saying the president is having mild symptoms.
Mark Meadows came out, spoke to reporters, and said the president was experiencing mild symptoms, didn't get into much detail beyond that. We also heard from Mitch McConnell, the Republican leader in the Senate, who said that he spoke to the president as well and described the president as being in good spirits and that they talked business about the upcoming confirmation effort for Amy Coney Barrett. So that's what we have. I thought it was notable, by the way, George, that Mark Meadows came out of the West Wing to talk to reporters. He, of course, has had a lot of quality time with the president and with Hope Hicks over the past several days. And he came out without wearing a mask, talking to reporters. So still don't get the sense that there's much more in terms of major precautions being taken, even after this at the White House.
So, John, we know Hope Hicks has tested positive. We know the president has tested positive. We know Ronna McDaniel, the chair of the RNC, have tested positive. Many cabinet members are coming out saying that they have negative tests as well. What more can you tell us about the kind of contact tracing now going on inside the White House, across the administration, even on Capitol Hill? Of course, the president had many events over the last several days, including after they knew that Hope Hicks, who we see on the screen right there, was showing symptoms on Wednesday night.
There have been a number of events. The White House tells us they're doing extensive contact tracing. But I can tell you that, as you know, former Governor Chris Christie was at debate prep with the president, and he, as of earlier today, had not been contacted by anybody at the White House to inform him about Hope Hicks. So the contact tracing, I don't know how thorough it really is. Mike Lee, the Republican senator from Utah, he was at the White House event over the weekend for Amy Coney Barrett for the announcement of that nomination, and he, we have now learned, has tested positive. So, as you know, that was an event. It was very crowded in the Rose Garden, almost nobody wearing masks, people seated in the Rose Garden outside, but seated shoulder to shoulder. So it seems to me that there is quite a bit of contact tracing still to be done. I have also heard of another staffer, a lower-level staffer at the White House who has tested positive today as well.
So John, but this is all being gone through reporting, and in fact, and of course, the news that Hope Hicks had tested positive was gone through reporting. It didn't come affirmatively from the White House either. Are any plans at this point for the White House doctor to come forward and do a briefing, give us a full briefing on what the president's health condition is right now?
There's nothing on that. As you know, the White House did release the letter from the doctor detailing the president's positive test, but there's been no discussion of the doctor coming out to brief reporters. It's respondent I want to see, primarily because he's the president's doctor, but also because you just don't know how reliable the information is that you'll be getting from the White House political operatives. There's been so much, frankly, disinformation that has come out of the White House, information that has been incorrect about a number of topics, including unreliable information about the president's health in the past. So I think for the public to have any confidence about what they are hearing on the president's condition going forward, it is imperative to hear directly from the White House physician, who is a professional and a public servant.
Okay, let's talk to our doctor now. Dr. Jen Ashton is here right now. You're not the president's doctor. You are our doctor. But what we know so far is the president tested positive. He's got mild symptoms. What can we expect, 74-year-old man, overweight, over the course of the next days?
Well, George, first, we have to go by what we know are established risk factors for complications of COVID-19 disease as reported in the peer-reviewed medical literature. Being a man, twice the mortality risk across every age group compared to women. Being 74 years of age, a 5-time greater risk of requiring hospitalization compared to younger age group, age 18 to 29. And then obesity, a body mass index of 30, 3-time greater risk of being hospitalized. Now, we take those risk factors, but as we just heard from Jonathan, they are just numbers. Unless we hear specifically from the person who's providing medical care for the president, we cannot speculate, we cannot make these assessments. Every patient is taken as an individual and day by day.
But minimum 10 days of quarantine?
The recommendations are 10 days from when you first develop symptoms or test positive. Quarantine is for those people who are exposed, prolonged close contact, closer than 6 feet of distance for more than 15 minutes for 14 days. The testing, which I expect will be sequential and staggered and almost daily for certain people in this circle. We have to remember, George, we've talked about it before, there is no such thing as a perfect test, and there can be false negatives even with PCR.
Okay, Jen Ashton, thanks very much. I want to bring in Tara Moran. Tara Moran, hasn't been a major health crisis with the president in the White House, I guess, since Ronald Reagan was shot in 1981, but this immediately brings to mind questions about the 25th Amendment.
It does, George. That's the amendment passed after the assassination of John F. Kennedy, which provides for presidential succession and for the temporary transfer of presidential powers and duties to the vice president in the event that a president is incapacitated. Here, if by some chance President Trump felt that he wasn't up to the job, that he was really fighting this illness. There's no indication of that right now, but that he couldn't do his job. He would submit a written declaration to the Speaker of the House, the President pro tempore of the Senate, saying such, and Vice President Mike Pence would become the acting president. It's temporary. It's not a usurpation. And when he felt better and recovered, the president could just write a letter to the contrary, and he'd be president again. It gets harder if the president or any president falls into incapacity, isn't even able to make that declaration. In that event, and this has never happened in our history, the vice president would convene the cabinet, and the cabinet would vote. And if a majority voted that the president could not perform the duties of his office, the vice president would once again become acting president. Upon recovery, the president could reclaim his powers, or we would go forward from there. That is uncharted water. But right now, the 25th Amendment is there as the guardrails in this situation if it comes to that. And as I say, there's no sign of that at this point.
No sign of that yet, but so many unanswered questions in the wake of the president testing positive for the coronavirus. Questions about whether the campaign, how the campaign is going to go forward. Questions about whether the debates will go forward as well. Many questions yet to be answered. In the meantime, we have learned that Joe Biden has tested negative for the coronavirus. You see his tweet right there. I'm happy to report that Jill and I have tested negative for COVID. Thank you to everyone for your messages of concern. I hope this serves as a reminder. Wear a mask, keep social social distance, and wash your hands. I see Dr. Jen Ashton nodding her head right there. With that, we're going to return now to our regular programs. We'll have full updates all day long on ABC News Live, and of course, a wrap-up tonight on World News Tonight with David Muir.
This has been a special report from ABC News.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.